This video is just to teach how to isolate those deep abdominal muscles for those of you that are new to this movement, with a bit of an emphasis on trying to not grip too heavily through the pelvic floor, which is of course a different muscle altogether. The best position we find is actually learning this on your side, knees bent just so that they're comfortable. You might want to rest your head down on your arm, or actually even in fact have a pillow. I'm going to prop myself up just for ease of this video, but do make sure when you're practicing you're nice and relaxed. Where you want to be aiming for is a sensation of movement in this lower part of your tummy without gripping too heavily in the pelvic floor. And for your brain, it might be easier to compartmentalize thinking about lower tummy and around the back passage specifically. The back passage is the muscle we want to not work too heavily, and it's the lower tummy that we really want to engage. You might find that they both come on together, and this is what we want to try and separate out through this practice. So your upper body's nice and relaxed. You're breathing normally here, so no belly breathing, just normal breathing. And the last thing I'll say on the breathing thing is try not to hold your breath. Sounds really silly and really like that would be fairly obvious, but it's amazing how easy it is to get into a breath hold here, and that isn't good for core stability. So try to just regulate your breathing like you're having a conversation with somebody. We're not doing the belly breathing, normal conversational breathing. And as you continue to breathe, I want you to draw your attention to this lower part of your tummy and just try to pull in those deep abdominals so that you feel this part of your tummy moving backwards and inwards towards your spine. It's a very, very, very gentle, subtle movement that sometimes you can even feel with your hand. If you squeeze, it will just feel a little bit more firm under your fingertips. So let's do that together now. So drawing in that lower tummy, but just trying to keep breathing normally and not gripping too heavily around the back passage. It's really about that lower tummy muscle, holding it there for a few moments and then releasing. Give that a go. Good luck.